Welcome back to the second year of medical school lectures. Now in this one, we're going to discuss how USMLE questions are composed and the format that they use called clinical vignettes. Then we're going to discuss how to study effectively from a question bank with the aid of a book and a video reference, two critical topics. So, USMLE Step 1 uses what are called clinical vignettes to assess each student's basic science knowledge. Each question that you will see has the same general format. So each question will have a single patient-centered vignette. This is a fancy word to just mean that each question will discuss a single patient. So simple. Then each question will have an associated 4 or more response options. This again just means the question will give you 4 or more answer choices. So you'll see like the question, it's a paragraph, and then A, B, C, D, etc. with an answer. Then, each question requires you to be able to assess the patient in the question, and depending on how the question is designed, it may ask you to interpret laboratory data, radiographic data, or graphic charts. This means, again, in more simple language, lab values. Sodium is 142, potassium is 4.6, whatever. Radiographic data, here's a chest x-ray, see what you see. Or graphical data, here are charts of a biostatistical study, what do you see? Then, each clinical vignette will end with a single question that they're being asked. And the test taker is then required to select the single best answer to that question. Now I said those two parts kind of weird to highlight it to you because this is the trick. They will give you a single patient to talk about. Well, that makes sense. And they will have information in there about the patient. Could be historical, could be numbers. Again, that kind of makes sense in the practice of medicine. Here's where it gets tricky. They're going to be asking you a single question. So the first thing you have to do is know what the question's being asked. Vital to knowing every single test question, always say to yourself, what's the question being asked here? And usually it's pretty obvious. The hard part is this. You are required to select the single best answer. And if I could scream that at you any louder, I would. That's where it gets tricky. A lot of answer choices may be correct. So often more than one answer may seem correct or could even partially be correct. And the test taker then is required to select the single best question being asked. This is the root of the challenge of all USMLE step questions, finding the single best answer. So the question becomes, well, how do you answer USMLE questions? You're emphasizing the single best concept, what do I do? Now, every single student will have and develop their own strategy on how to set up and answer a USMLE Step 1 question. However, in general, the following strategy is the core of what all students do, and it's what I recommend as well. So here's what I want you to do. You're on test day, you're practicing using a question bank, using a book, whatever. You have a question in front of you. I want you to start by reading the last sentence or two of the question first. It's best to know what you're being asked before you read the entire question stem. Often, question stems can be long and full of information that's not necessary to get to the right answer. So start with the last sentence or two. Find out what they want you to ask, or they want you to answer, that is. After you know what question they are asking, quickly scan the answer choices. You don't have to read them carefully. Just get a sense of what type of answer choices are available to the question they're asking. Now this is a bit of an elevated point. What you're going to be doing when you're looking at answer choices is ask yourself, is this a diagnostic question? Are they asking me what would I do to help diagnose? Is it a therapeutic question? What answer am I going to pick to give a treatment therapy? So just look at the answers and figure out the gist or the general category of what answer you're looking at. So by looking at that and thinking in that category sense, you may be able to eliminate answers right away. An answer choice may not be like the others. Two are identical but with little different wording. So you can use basic test-taking strategy just by looking at the answer choices before you've even read the vignette. So you read the last sentence or two to find the question, what they're asking you. You quickly scan the answer choices and figure out categories. Then I want you to carefully read the question. So we've timed it out. We looked at the total number of questions you have and the total number of minutes on test day. You have over 1.5 minutes to read and answer each question. So read carefully, but read quickly. 1.5 minutes is not that long. Now, for some, you're going to have to interpret not just the paragraph about the patient, but also laboratory radiographic data or charts. Now, this is where having lots of cube bank or question bank experience comes in handy. When you do lots of question banks, you will learn the wording of these questions. You'll become familiar with how they present laboratory data, imaging data, and this familiarity allows you to move more quickly. Since you already know the question being asked when you're attacking a question, you scan the answers. Try to come up with an answer in your head before you go on to the answer choices. Once you have an answer, then go to the answer choices and start eliminating ones that are just totally wrong. Then hopefully by the end you'll have a single best answer. But let's be honest, life isn't that perfect. You're probably going to be left with more than one. Then you're going to use test-taking strategy to help you narrow your choices. Okay? So what is the point of this strategy? Number one, the point of the above strategy we just went through is to never, ever, okay, listen, never, ever start by just reading the question from the top, working your way down, getting to the answer choices. That's not what seems natural, read the question, read the answers, is actually the wrong technique. Our strategy is reverse. It's bottom up essentially, and it's dynamic. You go from the question, the answer choices, you read, you come back to the answer choices. It's very fluid. This leads you to answering the question more often than not correctly. So we talked about how questions are formed and how you should attack them. But we also mentioned the importance of becoming familiar with a question bank. So how do you use them? How do you study from a question bank? Now, question banks are amazing. What better way to actively engage yourself than with questions and then be able to learn with a response? But not all students use these question banks correctly, and that's what we're going to address. How to effectively study from a question bank according to each variable that we see in a question bank. So let's go through those. First, when using a question bank, you have the option of how many questions for the question bank to give you in a block. A block is just, all that means is they're going to give you a bunch of questions. How many do you want them to give you at each time? We just call that a block. Now, I want you to always, did I say sometimes? No, always, I want you to do 40 questions, okay? The real exam, you need to emulate. So the actual USMLE exam, you need to simulate it with the question bank. And the real exam has 40 questions. So how many questions do I want you to do? That's right, do 40. If you said 20, come on, you're killing me. There is no value in doing 20 questions, doing anything but 40. Simulate the actual exam every single time. Build that endurance to say, whenever I sit down with a question bank, I'm going to be hit with 40 questions. So when you sit down on test day, boom, you get hit with 40 questions. It's automatic. You have reflexes. You're going to do great. Now, some students may make the argument, you may be making this argument while listening, that, you know what, I just want to do 10 questions because I'm short on time. Well, this is actually kind of a tough talking point, since you should only be doing a question bank when you are studying and you have time to sit down with full, uninterrupted focus. Don't do question banks on your cell phone while a shopping line and coffee shop. Now, why do I have such a specific example? I saw it just last week. It's step 1 season, a lot of question banks you can bring up on your smartphone. This guy is sitting there in a line at a Starbucks going through his question bank. That's not how you use a question bank. If you just want to review an old bank for good old fun's sake, that's fine. But if you're going through the question, that's not the way to do it. Use the time when you're standing in a line at a coffee shop to watch lecturio videos. You can access them on your phone. Pull up PDFs of a book you're reading that's high yield. Use question banks only when you can give it your full simulated test day experience with full focus. It is not something to be used passively. And let me tell you why. You will build within yourself false confidence. If you are doing a question bank kind of passively, you're kind of getting it right, you're kind of getting it wrong, you're quickly reading the answer choices, you're going to go through that question bank at some point and finish it. You're going to feel, oh, I've done a bunch of the question bank, I'm doing great. Unfortunately, you did that question bank but without full focus, and you didn't pull all the great stuff out of it. So only do question banks when you can give them your full, undivided attention. Second, the question bank itself will then ask you, okay, so I'm giving you now 40 questions, because that's how much you're going to do every time, if you want the exam timed or untimed, and if you want it in test mode and in tutor mode. The answers here are simple. Always do them timed and always do them in test mode. Again, you're trying to simulate the exam day. Timed just means, do you want there to be a countdown timer at the bottom? So doing 40 questions will give you 60 minutes. Do you want them to put that timer there, and when the clock runs out, close the test? Of course you do. You always want to simulate that exam experience. So when you're sitting at home and doing these timed tests, you're going to be doing the question, looking down at the time and going, oh, time's kind of running out, I better speed up. So on test day, when you're taking it and you're seeing time go down, you've already built the mental and physical reflex to speed up or slow down depending on how much time you have. The next variable there was, remember, test mode. You do not want to ever do tutor mode. Test mode says you're going to do 40 blocks, and we've already said, 40 questions in your block, and you're already going to do them in 60 minutes timed. Test mode means you have to take all the questions and answer them, and after you finish the test and hit submit, then it will give you all the answer choices and the descriptions. Tutor mode means every time you hit a question and give an answer, right then it'll give you the answer, right or wrong, and the solutions. That's not how test day is. Test day is test mode. So always do 40 questions, timed, and test mode. There's no other reason for anything else. Now, the benefit here is that you spend, with this technique, a solid hour in time mode going through 40 questions, just like on test day. After you finish the block, then you can spend dedicated time going through each question in full study mode. Thus, studying from a question bank then comes in two modes. First, you sit down for an hour and you take the test block, then you study the test block afterwards with a textbook and reference. The third variable to consider here is your environment. When you sit down to do a block of question bank questions, it will take you 1 hour because you're always going to be doing 40 questions. Since we're always trying to simulate the exam, you want to make sure you're sitting down in a quiet location without interruption. Put your cell phone in airplane mode, everything goes on halt. For that 1 hour, you do the block and nothing else. Now, after you've done that block in full test day simulation format, now you have to go through each question and study it. This is where it actually gets fun. And this is the entire purpose of the QBank. So start with the first, so you've done the test, you're like, okay, did a great job, sat down for an hour, simulated the test, let's go through it, let's learn. So start with the first question. What I want you to do when going through and studying is reread the question quickly and scan the answer choices again. See if you got the answer, or the question that is, right or wrong, and see what the other answer choices was. Then go to the description below the correct answer choice. Whether you got the question right or wrong, I want you to do the exact same thing. Doesn't make a difference if you got it right or wrong. So underneath the question answer, there's going to be a description. Read the description and see if there was an absence of knowledge or a lack of ability to interpret the data that was the cause of you possibly getting the question wrong. Maybe you misunderstood the question being asked, or maybe you selected a partially correct answer and not the single best answer. The purpose of going through to the correct answer is to figure out why the correct answer is correct. And if you got it wrong, where along the decision-making progress you went down the wrong path. What you need to be able to do is identify from each question why you got it wrong, or even if you got it right, what led you to that process. So if you get it wrong, you need to see if you lacked knowledge, and if so, if you need to read more about that topic. If you lacked test-taking strategy or were tricked by the wording of the style of the question, you need to then make yourself aware of this. Oh, I didn't know what the question was being asked. That's okay. Go back and see how they played with their wording. Become familiar with that. Oh, I picked a partial correct answer. That's okay. Go back and say, why was the other answer more correct than the one I picked? This is how you learn from the mistakes and actually strengthen, which is arguably an extremely very important variable, your USMLE test-taking skills. So knowledge is one component and simple test-taking skills are another. And thankfully with the QBank you get to know both. Okay, now that you've looked at the correct answer choice, I want you to go through all the other answer choices that were wrong and figure out why these answer choices are wrong. Learning why the other options are wrong is actually just as important as knowing why the actual answer choice that was correct. And here's why. on the actual test day. So an actual question on test day may concern a topic from one of the wrong answer choices in a question. So while going through a Q bank, not only are you learning knowledge from the right answer, but you're also learning knowledge of all the wrong answers as well. So every single Q bank question really concerns 4 or more learning points. So remember, and this always stuck in my mind, if I'm looking at a question bank question and I got it right and I look at the wrong answers, ask yourself, why are these wrong, and learn them, because on test day, one of those wrong answers may be right for another question. Now that you've gone through all the wrong answers, open your book to a section relevant to the question bank in that topic. And you will review and add information that is valuable from the question bank into the book itself. So open the book, read the stuff, think, oh, okay, I see what's going on here. Look at the Q bank. If there's any more high yield information, go ahead and write it in there. And if you find yourself going, you know what, I need to do more learning on the topic, now is the absolute best time to review the material from that question. What better time to learn more about a topic than when you're going through a Q bank question, going through your high yield book? That's the golden moment for you. So take advantage of that time, pause what you're doing, go to a resource. So as you can see, this process of going through a question is quite lengthy. This is how you attack a Q bank and a USMLE type question. So studying from a question bank is without a doubt time intensive. It's a very active process of reading, thinking, strategizing questions, and then looking up information. It is time intensive and it requires your full undivided attention. Once again highlighting why you should always be emulating test day and only sitting down when you can give it your full attention. So let's summarize what we've talked about. The USMLE Step 1 exam questions are in the form of what are known as clinical vignettes. Each question will have a single clinical patient, ask a single question, and have a single best answer. Studying for the USMLE exam requires using a question bank. There's no question about that. When doing questions, make sure you always simulate the actual exam day. When studying from a question bank, use the careful process of learning from each question's both right answers and all the wrong answers. And make sure that you're using a text or video reference to help you study while you're studying the question bank. Thank you.
Let's take a look at the exam itself. Remember that long stem questions are actually quite hard and they take a long time. Read the last 2 sentences first and then go back and read the stem, because sometimes the stem is not relevant to the question itself. Let me show you an example. Let's take a look at this case here I've got on my computer. A 2-year-old is brought into the ER by his panicked parents. His parents said that he ate some pills, possibly antibiotics. His father, blah, 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 blah. Kind of gets boring. Let's look at the last 2 sentences of that question, and I'm going to highlight them for you so you can see it nice and clear. The bottle label says that the substance has a pKa of 3.8. What percentage of the drug will be hydrophobic or lipid soluble in the small bowel at a pH of 4.8? If you think about it, this is a pH question. This is not about a clinical case. It's really about figuring out how to use pKa and pH to figure out the percentage of soluble ions, right? You don't need the rest of that. This particular question, you can see that the stem is really not relevant to the rest of the exam. And so this way you can come up with the answer. Now we're going to do the same question on the lectures, so have a look for this question later. The next thing I want you to be aware of on exams are what I call fuzzifiers. I know that's not a real word, but I'll show you exactly what I mean. Let's look at another question on my computer. So this is a nonsensical question, obviously. We've spent millions of dollars trying to answer which species Goofy belongs to. Goofy is A, definitely a dog, B, not a dog, C, maybe a mutated dog that talks, and Pluto is a regular dog, or D, is definitely a cow because his girlfriend is a cow. Now, obviously, the answer is going to be debatable, and in fact, here at the office, we had a long debate about what kind of species Goofy is. But when you take a look at the question, if you notice the difference between A and B, there's a fuzzifier in C, right? So A and B are very specific. They're saying definitely a dog or not a dog. C says maybe a mutated dog that talks. And Pluto, that's irrelevant. And D is also a definite kind of a question. So C has a fuzzifier and it has the word may. And generally speaking, when you have a question that has an answer that says may be or may not be, that's usually the correct answer. So sometimes fuzzy answers are the correct ones. Now let's do another one. This is a nonsensical question that strategic students were able to answer correctly 50% of the time. A 40-year-old, 6-foot-tall yellow bird has a sore back. The following is true. A, the gizzard pulls on the wetback, always resulting in a kite deformity. B, the gizzard pulls on the wetback, preventing a kite deformity. C, the gizzard pulls on the wetback, which may result in a kite deformity. And D, the beak is pulling on the wetback, which always results in a kite deformity. Let's figure it out. Of course, this question means nothing. It's nonsense. But you can see that one of them is like the other. Three of them are kind of the same. Okay, I won't sing the whole song, but you know what I'm getting at. C has a fuzzifier in it. It has the word may in it. And generally speaking, that's going to be the correct answer. The other thing that you want to be aware of is something called double negatives. Sometimes examiners use double negative, not necessarily as a trick, but just as a means of testing you. An example of this is the term less lipophilic to substitute or confuse you with the word more hydrophobic. It helps to convert terms into one term to make it easier to understand. Let me show you what I mean. The hepatic metabolism of most drugs results in the following, and choose one. A, the daughter drug is more lipophilic than the parent drug. B, the daughter drug is less lipophilic than the parent drug. C, the daughter drug is more hydrophobic than the parent drug. D, glucuronidation through a phase 1 process at cytochrome P450. And then there's E, increased volume of distribution. So when you're looking at this, remember that lipophilic is the same as hydrophobic. And remember that lipophobic is the same as hydrophilic. Convert the terms into something common. In this case, you know that hepatic metabolism results in drugs that are more hydrophobic. So let's convert the questions into hydrophobic statements. So A, we're going to take out more lipophilic and convert it into less hydrophilic. B, we're going to convert less lipophilic and convert it into more hydrophilic. With C, we're going to convert more hydrophobic into less hydrophilic. Okay, couple of points. First, you can see that now that you've converted the terms, it makes more sense and it's easier to understand the question. Second, you notice that A and B are opposite to each other. B and C are opposite to each other, and C and A are the same. So right away, without knowing anything about lipophilicity and hydrophilicity, you know that it's impossible to have two correct answers. Doesn't that make sense? So right away, you know A and C have to be wrong without knowing anything about science. And you also know that because there's an opposite there, B, meaning B, that if the wrong answer is wrong, then the opposite of the wrong answer must be right. So therefore, D and E are actually not useful or not relevant to the question. So let's take a look at the answer. So you can see that A and C are wrong and B is correct. Honestly, there's no trick questions. When we as examiners try to come up with a question, it's actually really hard. And what we're trying to do when we make a question is we're trying to test you on a learning point. We're not trying to test you on your ability to understand English. And a lot of times we make mistakes making questions, and we try not to do that. Remember that if an answer could possibly be true, we try not to put it into the question. But in rare circumstances, we're not thinking perhaps as complexly as you are, and perhaps you're reading into a question a little bit too much. Relax. Take a look at a question. If there's two potentially correct answers, think about what the examiner must be thinking and come up with a more simple answer, because that's probably the correct answer. An 80-year-old male with chronic constipation presents with severe gastroesophageal reflux after a large turkey dinner. The best choice for acute treatment in this individual is A. Aluminum hydroxide, B. Magnesium oxide, C. Calcium carbonate, D. Sodium bicarbonate, and E. Metoclopramide. In this question, it feels like a trick because all of these agents are bowel active agents and could be used, right? Not quite. This is not a trick. The examiner is trying to isolate one of them from the others to teach you that one of these agents is the best choice in this patient. So let's look at that stem again. This man is 80 years old. He has chronic constipation and he has gastroesophageal reflux disease and he has just eaten. Why would the examiner tell you that? Because it's relevant. Listen, relax, you know this. What would you do at home with Grandpa if he had two problems at the same time and you wanted to give him something to feel better? The answer is magnesium oxide. And what the examiner is trying to ask you is this. Aluminum hydroxide, which is also known as Maalox, can be constipating. It's not a great choice in this patient with chronic constipation. Calcium carbonate and sodium bicarbonate are weaker antacids, so they're going to treat the acid problem but not the constipation problem, right? Metoclopramide is a promotility agent, so it's going to treat the constipation but not the acid issue. The answer is going to be B, magnesium oxide or milk of magnesia, which has laxative, anti-acid, and soothing effects on the elderly bowel. After you've done the pharmacology lecture, you'll know this answer, but also I want to stress the fact that this kind of a question shows that the examiner isn't honestly trying to trick you. And you know this information. This is something that you understand, but when you're faced with the question, it looks a lot harder than it actually is. Okay, let's take those skills that we just learned and let's try narrowing down the choices here to 2 out of the 5 choices. Now, I've blocked part of the answer to the next question, so there's no way that you can use your medical knowledge to figure out the answer. You have to use your logic to choose or eliminate half of the choices. Let's look at my computer screen here. So a 55-year-old male has diabetic enteropathy with poor bowel function. He was placed on domperidone. The following statements are true except. Okay, so let's look at the answers. Metoclopramide and domperidone are blank. Domperidone crosses the blank. Metoclopramide and domperidone may be used in blank. And metoclopramide may cause blank. Okay, let's look at the fuzzifiers here. So first of all, in terms of the fuzzifiers, C and D have fuzzifiers in them. So these statements are probably true. Now let's take a look at the question. One of the things that I always do when I write an exam is I either circle or really pay attention to negatives in the question. So look at that. It says the following statements are true except. So we're looking for the false statement. And we've already established that C and D are true statements. So C and D are not the answer here. Therefore, the answer has to be either A or B. Do you follow my logic? Okay, let's look at the answers. So B, we were right. We got 1 out of the 2 just looking at the way that the structure of the question was. So the following statements are true except domperidone crosses the blood-brain barrier. So just for your own information, and you'll learn this in the pharmacology lectures, domperidone does not cross the blood-brain barrier, so it is the incorrect answer in this question, and therefore that would be the one that we put down because we have except up in the stem, right? So that's how we're able to use logic to answer questions.